Yes, so we are going into this session of prioritizing health problems. This actually comes after you have done an assessment, a health needs assessment. So perhaps you have done what you call a desktop review. You have gone into the community, asked them questions through your checklist questionnaires, and maybe interview guides. So you come up with a number of problems the community is facing in regards to health. So basically, you need to decide what interventions you actually have to implement to address specific health problems. So a health problem, first of all, is a situation or is a condition, basically a condition or an issue that affects the health of individuals or populations. Understanding the extent of the health problem is very important because it is only then that we can plan and implement programs that are efficient, effective in addressing the health problem that we have. So first of all, assessing the health problem generally, or the health status or the burden of a given disease is very key, and you can use a number of sources. The primary sources of data, where you are the one who goes into the community, collect the data using questionnaires, checklists, interview guides, observations, and others. Or you can use secondary sources of data where you use already collected data. It can be in the vital registration systems, at the health facility, and also you can use that health database or health information systems, or even you can base on the national demographic surveys, the report, if you have those reports. Okay, so you can get information about a health problem across those sources. Okay. So having, for example, if you have identified the health problem, let us say the problems are as follows. One, we have numerous cases of, or an increment in the cases of diarrheal conditions. Okay, that's one problem. Another problem is that we have an increased prevalence of malnutrition among the children under 5. Okay, so those are problems that you have. Or maybe the community members are not utilizing the health services available at the nearest health facility. Okay, so you need to describe this problem clearly, such that it gives you proper understanding of how the intervention would be. In the design part or the planning part it's very important to clearly and accurately describe the health problem, because it is through that description or that understanding of the health problem that you have a very good intervention. Okay, so in describing the health problem, you need to state what exactly the health problem is. Who is being affected by the health problem? When is the health problem occurring? Is it throughout the year, or is it through the rainy season or the dry season? And what are the factors associated with the problem? Basically, you're asking the why part. Use language that is understandable and very clear. Clear and concise language is very important in writing such a report. Remember that this report is very important even for people who are not in the health sector. Remember, you are going to engage with the community leaders in designing this program. So you don't want to be using a lot of technical language that will not be understood by the key stakeholders. Make sure that you have this data well presented. That means that you need to use pie charts, graphs, even text, images, whatever you can, to present this problem in a logical way, in an organized manner. It's also very important to describe the factors associated with the health problem. They could be social factors, cultural factors, economic factors, whatever they are. Make sure that you bring that picture out clearly. And those who are affected in terms of either age, sex, income levels, or educational status. Like we said earlier on, you can do a desktop review, or you can go and carry out the data, the data collection yourself. Okay, so basically you come up with what we call the situation analysis. When you understand the complete picture of the health situation within a given community, you're looking at the conditions that are affecting the community, the nature of the health system, the policies, the social determinants of health, the risk factors, and then the outcomes, health outcomes. You basically have a comprehensive picture of the health status of the given community after conducting a spatial analysis. You can also use tools such as the problem tree, stakeholder analysis, and SWOT analysis to understand the other factors that are associated with the health problem, the causes, the effects, and the factors that could be mediating, aggravating the problem. This is very important. The reason that's why you need to look at those factors is because it will lead you to the right interventions. So you need to connect the different factors. You need to be able to connect the required factors, the required antecedent factors, the main causative factors, the mediating factors, and the moderating factors. And then what you really need to do to cause the desired outcome and impact. This framework here, the causal theory, allows you to do that. So you basically need to list these factors here and then the suggested interventions. So it gives a good visualization of the nature of programs that you are going to implement. This is an effective tool for communication with the different stakeholders that you have in a project. So let us look at these factors and what they really mean. The required antecedent factors are those conditions that must exist for a health problem to occur. Okay, so if it is, let us say the problem is sickle cell, then there should be genetic predisposition. Okay, if the problem is about road traffic accidents, then maybe it is because the legal frameworks that regulate driving are not efficient. Or if the problem is because of diseases caused by exposure to environmental toxins, then it means that the sources of toxins or exposures should actually exist. Okay, for the people to get the conditions associated with those factors. And then vulnerability. There are communities that have particular, that have an increased risk of getting particular diseases or particular conditions because of their perhaps socioeconomic status, marginalization, whether they're children, whether they are pregnant women. Okay, so we need to understand the vulnerability. So there are some factors which should be there for the condition to happen. So we need to look at that. And then we look at now the causative factors. Okay, these ones influence whether the health problem will manifest or not. Okay, so if you have cases of malnutrition, then most likely it is because of deficiency of nutritious foods. Okay, or it is because people have been exposed to virulent microbes. Okay, or is it because they have a weak immune system? So that means they have increased susceptibility to infections, something like that. So these are the causative factors. And then you have those that modify moderating factors that actually modify the health condition may exacerbate or may actually lessen the health problem. So, for example, if the problem is because of if you have diarrheal conditions as the problem, and then on top of diarrheal conditions, we have increased rates of acute malnutrition. Then it means the acute malnutrition will cause the diarrheal conditions to be actually worse. Or the diarrheal conditions actually cause acute malnutrition. Okay, so these are moderating factors. They can increase or decrease. Then we have what we call the mediating factors. These ones happen between the cause and the health outcomes. Okay, this could be, for example, the health system. If the health system is responsive and can address some of these illnesses or health problems, then the better. But if the health system is weak, then you can have poor outcomes. And then, so now we look at the indicators of the health problems. For example, you want to basically describe the extent to which the health problem is existing within the community, where we talked about who is being affected, okay? But how many of those who are affected, how many of those people, or how many people within a particular community are affected by the health problem? Okay, so for example, we can say that the problem affects women aged between 15 and 45. So that is who. But the magnitude is what now we are looking at. How much, to what extent, okay? So we look at what we call morbidity and mortality. Morbidity is prevalence and incidence. Incidence is number of new cases of a particular disease in a particular population at a given time. And then prevalence is the number of people who have a particular disease in a particular population at a particular time. And then mortality is the number of people who die, or the number of deaths in a given population. And then sometimes you have disability, okay? The person may not really die of the condition, but may get a disability. It could be that they become disabled. They can no longer work as they used to work. So that is disability. And then quality of life is general well-being. If you get a condition, you are not going to work as you used to, okay? So your general quality of life goes down. So these are things that we actually have to look at. All these are measures. They can be calculated and then you come up with a figure. Okay? And that's why we are calling them indicators. They are measurable. They are measurable. And therefore, we can use this to understand the burden of a particular condition. Okay? So, for example, in a community, you have malaria and then you have diarrheal conditions. So, where are you going to put your resources? Or maybe let us say you have malaria, you have people with diabetes, you have people with HIV, tuberculosis. Where are you going to put your resources? There are many factors that you have to look at. The magnitude, how many people are being affected by a particular disease? Now that one goes back to prevalence. Okay, and then severity. The extent of suffering or consequence caused by the health problem. Okay. For example, comparing Ebola to malaria, definitely Ebola has a lot of, first of all, the fatality rate, the number of people who die if they get Ebola is high compared to the number of people who die if they get malaria, for example. Okay, so the fatality rate is very high. The impact of Ebola is extremely very high. But also you can look at the extent of disruption that is caused by Ebola itself, because there will be restrictions, limited movements, and things like that. So that is about severity. And then vulnerability. We have some members within a population that are most likely going to be affected by a certain health condition. And you remember, in public health, our emphasis is that everyone should have an equal opportunity to be healthy. Okay. So that is vulnerability. And then we have feasibility. What resources do you have to implement the project, the project to address the health problem? And then equity, still related to my earlier explanations, that you want to share resources for different programs in a fair manner according to the health needs. So that is about equity. So you can use a number of frameworks to basically decide. You can use, for example, PAL, looking at the just, the fairness, the equity issues associated with a particular intervention to address a problem. That is proprietary P. And then economics, the resources, economic resources needed, and maybe the impact of the intervention. Is the intervention acceptable? What resources do you have? The legality of the intervention that you want to implement. Okay. So my earlier description basically looks at different things that you really have to consider. But now we are going to look at the models and frameworks that you can use in deciding what to deal with. For example, in our earlier explanations here, these are basically what you can call burden of a health condition or burden of a particular disease, these factors here. So basically, we can use these factors to decide on what we can implement. Okay, so the first framework is what we call the burden of disease approach, which basically looks at the quality of life, the mortalities and morbidity issues. These are actually calculated in epidemiology. The calculation of prevalence, incidence, quality of life, the adjusted quality of life years, and things like that are calculated in epidemiology. And then you can look at the economics, which is basically cost-effective and effectiveness analysis. You want to have an intervention that achieves the most outcomes. Okay, you want to have value for money in your interventions. And then you can use what we call the multi-criteria decision analysis. Okay, that means that you look at what the stakeholders are thinking, what they want what they want in terms of the intervention. What type of intervention do they actually want? So different people will give different opinions or different weighing and scoring. And then based on overall scores, you basically decide. And one of those scoring frameworks is what we are going to look at later on. And then, so we have the essential health services approach. With this, you want to make sure that the basic or the essential health services are actually provided to the community. So it prioritizes health problems that align with the availability and capacity to deliver essential services. So we look at issues to do with the cost, feasibility, and equity. So the scoring one, that is the basic priority rating formula. Okay, and this one looks at how we can prioritize tasks, projects, or even issues based on whether they are urgent or very important. So the formula is that you have A, which stands for important factors, and then B, which stands for urgency factors, and then C, which is the resource availability factor. Okay, so you look at those factors and assign them scores. It can be a score of 1 to 5, or 1 to 10. The higher the score means it indicates great significance. Okay, so the same to urgent factor and also resource availability factor. Okay, and then you calculate. You just feed in the values that you have assigned. Okay, and then you make the interpretation. The higher the score, that means the more urgent or important the intervention is. The lower the score, that means the less attention that you can pay to this project. So basically, that is how you decide on which intervention to implement. We have a number of frameworks that you can use and a number of factors to look at in deciding where to put the resources. Thank you very much.